In practicing the body scan, we begin by coming to rest, lying on your back on a comfortable surface, with your arms lying alongside but not touching your body, with your palms facing upwards towards the ceiling or sky if this is comfortable for you, and with your feet gently falling away from each other. If lying in this position is uncomfortable for you, then finding a posture that supports you during the body scan. So finding a more comfortable position for you if you need to, or sitting in a chair. Whatever helps you now to begin a gentle and systematic exploration of your body, simply using your awareness to more fully discover what is here in your body right now. Although you're now lying on your back, perhaps with your eyes closed, this time is intended as an invitation to wake up to your experience rather than to drift into sleep. It may be helpful if you find this happening to practice with your eyes open at times, remembering throughout the body scan that we're not trying to achieve any special state, we're not trying to get anywhere, we're not even trying to relax. But instead we are gently building a capacity for greater awareness, an ability to be more fully present for the continuous unfolding of each unique moment as best we can. Recognizing throughout this any tendency to judge and evaluate your ability to do the body scan, and any sense of pushing or striving to do this right or correctly. Whenever this happens, as it's likely to do, remind yourself at these points that there is no right or wrong, no correct or incorrect, success or failure involved in the body scan. Just continuing as best you can to move your attention around the body, noticing what is in each region with a spirit of gentle exploration and curiosity. So whatever your experience is, this is your experience right now, perfectly itself, and this is what we need to know. This is what we're exploring and finding out about right now. Whenever the mind is pulled away into thinking, as it will be many times throughout this practice, simply noticing and recognizing where it has gone to, before gently guiding your attention back to whatever part of the body we're on. And aiming always to do this within the spirit of kindness, without self-criticism or giving yourself a hard time. Sometimes the practice may bring up discomfort, boredom, or impatience. And remembering that when or if this happens, it does not mean that you failed at the body scan. Seeing if it's possible to instead bring a curiosity to this, gently investigating the sensations accompanying each emotion, even the difficult and unpleasant ones, perhaps even especially these. Noticing how these states are expressed and played out in your body. So whatever happens, whatever comes up, that's okay. If sleepiness, discomfort or irritation arises, it may present an opportunity to bring awareness to these feelings rather than worrying about them or criticizing yourself for having them. As best you can, letting go of the tendency that we all have of wanting things to be a certain way, to be other than how they are right now, and allow things to be exactly as you find them throughout the body scan. And within this, allowing yourself to be exactly as you are. In each moment. So lying here now, and beginning by bringing attention to your body as a whole, your body in its entirety. the body simply resting in awareness, giving yourself over to feeling the sensations of contact now in all those places that your body is being supported by the surface that you're lying on. Opening up to all points of contact, tuning into the sense of the weight of the body as it's being held by the surface supporting you. Noticing any tension or holding in the body and letting go of this as best you can, and simply lying here, resting in awareness of your whole body without having to do anything. Noticing any movements occurring in the body right now. Tuning into the rise and fall of your abdomen as you breathe in and as you breathe out. As it gently lifts on each in-breath and relaxes on the out-breath. Just be with the sensations of breathing in this area down in the abdomen, down in the belly for a few moments as fully as you can. And now bringing awareness to the toes of your left foot. Let's see what sensations are here to be felt right now in the left foot, in the toes. So the big toe, the little toe, and all the toes in between. Any numbness or tingling or sensations of coolness or warmth, simply exploring what's here in this seemingly obscure and rarely noticed region of your body. And experimenting now with breathing down into the toes of your left foot. So imagining you're feeling the breath coming into the body, through the nose, down through the torso, and travelling down the whole of the left side of your body, the left leg, all the way out to the toes of the left foot. So filling this region here with the breath. As if you could guide your breath and direct it straight down to this part of the body. And then imagining or feeling the breath come back up through the left leg, out to the toes, through the left leg and out through the body as you breathe out from the toes of the left foot. So just playing with this for a few moments now, a few breaths, this idea of breathing into and out from the toes of the left foot. Noticing any change in the pattern of sensations in your toes as you breathe in this special way. Noticing as well any thoughts or judgments that you may be making about why you are doing this, or about how well you are doing this, or whether it's even possible. How easy or otherwise you're finding this. Recognizing these as thoughts and judgments and letting them go as best you can, just letting them be. Coming back to breathing down into the toes of the left foot and out from the toes of the left foot. And on an out breath now, letting go of the toes of the left foot and moving awareness around now to the bottom of your left foot, the sole of the foot, the ball of the foot, and the arch of the foot and the heel. Exploring it now simply by moving your attention across the surface area, being sensitive to what's here. Just a gentle exploration as we again breathe down into the sole of the left foot, directing the breath all the way down to the bottom of the left foot. And then as you breathe out, letting go of the bottom of the left foot and moving awareness now to the top of the left foot. So just in turn, moving awareness around the foot, exploring each bit of the foot in turn. So the surface of the foot now, the top of the foot, the skin and the bony area here. And round to the ankle joint, what's here? And breathe into and out from this area. And as you breathe out now, just letting go of the top of the left foot and bringing awareness to the left lower leg. The calf muscle at the back, making contact with the floor, and the bony shin along the front. Sensations of contact or pressure where the calf is making contact with the floor. Filling this region of the body with your awareness. Moving the breath now, breathing down into the calf muscle and shin, and as you breathe out, letting go of the left lower leg. Just letting it go now. And bringing awareness gradually up the body now, tracking your awareness up to the left knee, with the kneecap floating in front of the knee joint, the sides of the knee and the back of the knee. Noticing whether the back of the knee is resting on the floor or just slightly out of contact with this. And breathing into and out from the left knee. And on an out breath, letting go of the left knee and bringing awareness to the left upper leg, up to the groin on the inside and the hip on the outside. With the heavy thigh muscles, the femur running right through the centre, the long thigh bone. What sensations are here? Warmth perhaps, or heaviness. Whatever you find, just registering what's here for you now in the left upper leg. And breathing down into the left upper leg. And as you breathe out, letting go of the left upper leg and switching attention across directly now to the toes of the right foot. Not doing anything to feel the sensations, not moving or wriggling the toes, just noticing what's here, simply by dropping attention onto this precise area of your body. Expanding awareness now to include the bottom of the right foot as well as the toes. The sole of the foot, the ball and the arch and the heel. And the top of the right foot as well as the rest of the foot now. So encircling the whole of the right foot in your awareness, just holding it in this way. What's here? In this region of the body that bears at least half of the weight of your body as you're standing and walking. So just bring some curiosity now into this region, just to give it some attention and check out what's here. And breathing down into the whole of the right foot, taking a deeper, more deliberate breath all the way down into the right foot. Noticing any change in the pattern of sensations as you do this, and then as you breathe out, letting go of this area of the body and moving your awareness up to inhabit the right lower leg. Observing what sensations are here, being curious about how it feels here in this part of your body. Breathing down into the right lower leg, and as you breathe out, letting go of this area. Instead, allowing the right knee to take center stage in the field of your awareness. Checking in with your right knee. What's here? What sensations are occurring right now, however subtle or difficult to detect? So all the time, gently exploring, investigating each region of the body in turn, feeling or imagining the breath going down into the right knee, directing it down into the right knee, dwelling in this area for a few moments. Breathing out from the right knee, bringing awareness as you let go of the right knee, now bringing awareness to the right upper leg, all the way up to the pelvis, the back of the right upper leg, the front and the surface area and the sensations within this region. Taking a few moments to explore this, simply using your awareness. What's here? Noticing at any points if impatience, boredom, frustration, irritation, or any of these difficult emotions arise, any emotions or feeling states pulling you away from noticing how it is in the body. Recognizing that this too is your experience right now, and this is not wrong. It's how it is. If this is the case, then noticing where these emotions are felt in the body, any tension in the shoulders perhaps, in the chest, the abdomen or wherever, any sense of holding your breath, any urge to move or any sense of urgency, or agitation, and just opening up to the body, sensations accompanying these feelings, emotions, thoughts. And as best you can, just letting them be, letting them go, coming back to the sensations in the right upper leg. And breathing down into the right upper leg, and as you breathe out from this region, bringing awareness now to the pelvis, the back of the pelvis, which may be making contact with the floor. Noticing the precise points of contact here, and the sides of the pelvis, the whole of the pelvic girdle. And breathing into and out from this area, allowing your breath to fill this region. And as you breathe out, letting go of this region, letting go of the pelvis, and noticing now the lower back as it comes out of the pelvis, gently arching away from the floor perhaps. And the lower back is a region which can typically hold on to stress, aches, and be prone to chronic pains. So taking a few moments now to bring some attention to it, giving it some attention. Opening up to what's here. What's here in this region of the body, in the lower back right now. If there's any tension here, then as you breathe out, allowing this to flow out of this region to the extent that it will. And letting go of the lower back now and bringing awareness to your upper back. Moving awareness up through the torso, up to the upper back, your shoulder blades. The sensations of contact that these are making with the surface that you're lying on, and the slight rise and fall of the ribs, and the change of pressure and contact that the upper back is making with the floor as you breathe in and as you breathe out. Just tuning into this for a few moments, for a few breaths. Letting go of the upper back now on an out breath, and bringing awareness, allowing it to fill your abdominal cavity, your belly. Feel your breath, fill this space as you breathe in. Noticing the sensations here within your digestive tract and organs, the rise and fall of your abdomen as you breathe in and out. whatever is here to be felt, gently exploring and investigating. Letting go of the abdominal area on an out breath, allowing attention to move up through your torso to the chest area, the sternum and the rib cage housing the heart and the lungs and the major blood vessels of the body. Taking a moment now to see if it's possible to detect your heart beating. Noticing the sensations in your chest as your lungs fill with air, and then as they empty, as you breathe in and out. And taking a deeper breath, and allowing the lungs and the chest region to fill with air, and then as you breathe out, letting go of this area, bringing awareness now to your hands, and to both hands at the same time, beginning with the fingertips, the very tips, the pads at the ends of the fingers, down through the front of the fingers, the sides, and the back of each finger. And your thumbs as well, and the backs of your hands and the palms. Holding now as completely as you can your hands in awareness, putting full attention just into this region of your body. Expanding awareness now to include, as well as your hands, your wrists. Gradually expanding awareness, moving it up your arms to include the hands and wrists, and also your forearms, elbows, your upper arms, and the tops of your arms with the shoulders as well. Feeling any and all the sensations here from the shoulders all the way down the arms to the fingertips. Imagining or feeling your breath travelling all the way down from your shoulders through the arms and out to the hands and fingers. Pausing here for a moment and then back up, breathing back up and then out to the arms and the shoulders as you breathe out. And just breathing in this way for a few breaths now. Letting go of the hands and arms and shoulders now on an out breath. Noticing how it feels to let go of awareness in this region for a moment. And as you lie here, bringing awareness to your neck, to the back of your neck, and the front of your neck, the throat, with the lining of your throat on the inside, feeling the breath move through this area, making contact with the lining of the throat and the soft tissue in here, and breathing. Letting go of the neck as you breathe out. Bringing awareness to your face. And beginning with the point just at the bottom of each ear where your lower jaw attaches itself to the skull. Very gently, just tracking your awareness down towards your chin. Seeing if it's possible to discern sensations here. Moving awareness up to your lower lip and your upper lip. Just holding your lips now in awareness and directing attention into your mouth, your teeth, the roof of your mouth, your tongue, gums, holding the inside of your mouth in awareness, just noticing what's here. And back out now to the upper lip and the gap between your upper lip and the tip of your nose. A sensitive part of the body. And now the lining of your nostrils as the air comes into your body through your nose. Perhaps noticing the coolness of the air as it enters your body here. And how it can be slightly warmer as you breathe out. And the sides of your nose, the top of your nose, and the point just between your eyebrows. And your cheeks. So just moving awareness and attention now around the face, just gently exploring what's here. And the area around your eyes, all the tiny muscles here working tirelessly throughout the day, focusing and refocusing your vision. Just bringing awareness to this area, bringing to it some attentive awareness. And the eyebrows. And up to your forehead, and to your temples, ears, and to the top of your head and scalp, and the back of your head, which may be making contact with the floor or cushion. Now bring the whole of your face and head into awareness, breathing into your face and head, imagining your breath coming up through the neck and filling this whole region of your skull. So breathing into the skull, into the face, and as you breathe out, imagining a small circular area the size of a small coin, just opening in the top of your skull, like the blowhole of a whale or dolphin. So breathing out through the top of your skull. And imagining or sensing breathing in through this, And as you breathe in, imagining breathing in through the top of your head, and then imagining or feeling the breath travelling and washing all the way down through your body. And as you breathe out, through the soles of your feet. So breathing down through the body and out through the soles of your feet. And then breathing back in through the soles of your feet, with the breath travelling up all the way through your body and out through the top of your head. And so just breathing and playing with breathing in this particular way for the next few moments. Gradually coming to rest now, and as you do so, bringing awareness to the whole of your body, just as we did at the beginning of the body scan. Lying here, resting in full awareness of your body. Noticing how it feels in your body, and to be in your body, having been through this process of gradually moving attention around each area of your body. Lying here now with the whole of your body resting in awareness. Nowhere to go, just being where you are, right here, in this moment. As we finish this body scan, taking a moment to congratulate yourself for having taken this time to be with yourself and to nourish yourself in this way. And to recognize yourself within this as complete and whole, just as you are.